Okay, so today we are going to deal with hemodynamics of circulation. So hemo means blood, right? And dynamics means flow. So hemodynamics is basically the flow, right? And the study of the blood flow is called as hemodynamics. So we're going to study how the blood flow occurs in our circulation, what are the factors that affect the blood circulation. So all those things we are going to discuss today. All right. So blood flow is very important because we know that it carries nutrients, hormones, and many enzymes which is necessary to the tissue, and at the same time they carry away waste product from the tissues. So that blood flow is of very much importance in our circulation. So let us start with circulatory system. So you have already studied about how this circulation work. So let's have a quick recap how this circulation work. Okay. So we know that the oxygenated blood comes from the lungs by the pulmonary vein, right? And this oxygenated blood then is carried to the left ventricle. It is pushed to the left ventricle. From the left ventricle, the blood is ejected out from the aorta. Aorta, right? Now this aorta it divides to give branches, and they are called as arteries. These arteries they further divide to form arterioles, and these arterioles, right? They will be supplying different system of our body like central nervous system, GIT, kidney, muscles, etc. Right? And these arterioles they are going to further break down into capillaries, and capillaries, as we all know, that it is the area where gas exchange occurs, where the nutrients is being given to the tissue, and whatever waste products are formed from the tissue they are carried back to the capillaries, right? From capillaries the and eventually they drain into the superior and the inferior vena cava. And finally the blood will reach the right atrium, then push to the right ventricle. From the right ventricle the blood to the lung via the pulmonary arteries, right? So in the pulmonary artery we know that in the pulmonary artery the blood loses carbon dioxide and it gains oxygen from the environment, and that deoxygenated blood is again oxygenated and the circuit continues, right? Likewise, let us talk about a little bit about this pressure changes. So how these pressure changes occur in our circulation, right? So the pressure in the left atrium it is around 5 to 8 millimeter of mercury, and at the time of diastole the left ventricle is around 0 millimeter of mercury. Now when the left ventricle it starts contracting, then what happens? The pressure can rise to around 180 millimeter of mercury. Now this when this left ventricle contracts, then what happens? Via the aortic valve the blood will be pushed to the aorta, right? Now when the blood is pushed to aorta, that means the pressure in the aorta can also rise to around 120 millimeter of mercury. But at the time of diastole the pressure in the aorta will decline to around 80 millimeter of mercury. So there is certain properties of this aorta which help to maintain the pressure gradient, right? Now from the aorta the blood will be taken to the artery. Now what is this 93 millimeter of mercury? Because as the blood was being ejected was 120 millimeter of mercury. Now arterial pressure. So what do you understand by mean arterial pressure? Okay, before that I think you have to know what is systolic pressure and what is diastolic pressure. We'll be discussing systolic and diastolic blood pressure later, but just for today's discussion, systolic blood pressure is the pressure which is created at the time of systole of the heart, when the heart contracts. which is around 120 millimeter of mercury. And at the time of diastole or the relaxation of the heart, the pressure created is around 80 millimeter of mercury, which is the diastolic blood pressure, right? And then we need to know something called as pulse pressure. Pulse pressure is systolic pressure minus diastolic, which will come around 40. And now is mean arterial pressure. It's actually the pressure which is necessary for the blood to be pushed to the arterial side from the aorta, right? The aorta is getting arteries and then arterioles and final capillaries, right? Now, as the blood is reaching the aorta, that blood has to be pushed towards the capillaries. Now, that driving pressure is called as mean. How we calculate mean arterial pressure is diastolic pressure plus one-third of pulse pressure. So diastolic pressure plus one-third of pulse pressure will give you the mean arterial blood pressure. So if you put the value of systolic blood pressure, if you put the value of diastolic blood pressure and the pulse pressure is systolic blood pressure minus diastolic blood pressure. That will come around uh, uh, 80 or something, 40, 80 or something. Okay, so when you calculate it, this mean arterial pressure, it will come around 93 millimeter of mercury. That means 93 millimeter of mercury is required. That pressure is required for the blood to be pushed to the arterial side, and that is also called as the perfusion pressure, right? Now, as the blood is pushed to the arterioles and then to the capillaries, right? Now, as the blood reaches the capillaries, the pressure will decline to around 20 millimeter of mercury, and when the blood reaches the veins or venules, it will be around 15 to 4 millimeter of mercury. Now, as this blood is going towards the right atrium through the superior vena cava and the inferior vena cava, you can see that the pressure in the right atrium is around 0 to 2 millimeter of mercury. That means now the blood can easily flow through the right atrium, and then the blood will continue to flow to the right ventricle. Now, when the right ventricle contracts, the pressure will rise. The maximum pressure that can rise is 25 millimeter of mercury. So you see in the right ventricle and the left ventricle. When the left ventricle was contracting, the pressure rose to 120 millimeter of mercury. But when the right ventricle contract, the pressure increased was only 25 millimeter of mercury. So why do you think that the pressure has to increase so much in the left ventricle and why not in the right ventricle? Well, it is because left ventricle, they have a wall which is very thick than the right ventricle, right? And left ventricle pressure, it has to rise from 0 to 120 millimeter of mercury because we need a very high pressure because systemic circulation is very large, right? And for that blood to push to all the tissues and again back to right atrium, we need a lot of pressure. So that's why it's also called as the high pressure system, right? Because left ventricle has to push the blood to a large or a high or very large systemic circulation, right? And because of that, we need more pressure from the left ventricle. That's why left ventricle has more pressure created, right? Now, as the blood is flowing from the this right ventricle to the pulmonary artery, now the blood is going towards the lung, right? So the pressure in the pulmonary artery will be also around 25 millimeter of mercury as the right ventricle, right? And this blood as it is reaching the pulmonary circulation, pulmonary capillary. In the pulmonary capillary, the pressure will be around 80 millimeter of mercury, right? And in the pulmonary this vein, the pressure will be around 5 millimeter of mercury. So, because of this pressure gradient, the blood will keep flowing in our circulatory system. So, this is just a brief idea how the blood is flowing from the left atrium all the way to the lung and then back to the again to the left atrium, right? And we also talk about the pressure gradient, how this pressure gradient allows the blood to pass through the all of these vessels. So again the same thing. So here it is the general pathway of the blood flow. So we have already discussed that from the heart the blood is going to the aorta, then to the arteries, then arterioles and capillaries, then back to the venules, veins and the heart. So we're gonna see how each of these vessels help in the circulation, or how each of these vessels help in the blood flow. All right. So this is the systemic vascular tree, same again, but just a diagrammatic presentation. So we have the aorta over here, and it branch out to form the large artery. Then we have the small artery, and then we have the arteriole over here. Then this arteriole, they branch out further to form capillaries, and from the capillaries, draining will be towards the venule, then to the vein, and finally to the venica. So we're going to see how each of these vessels it help in the blood flow. So there are different type of blood vessels. We have arteries, arterioles, capillaries, veins, and venules, as we just discussed in that picture earlier. So the first one is aorta. It is also called as Wind-Kessel vessel. Well, aorta is called as Wind-Kessel vessel because they are highly elastic, and the meaning of Wind-Kessel is elastic reservoir. Okay, so aorta. Remember, the blood is flowing from the left ventricle towards the aorta, and as the blood is flowing to the aorta, like the blood is of very high pressure, and when the blood flows through the aorta they will just open up, or they will dilate, and they will accommodate all of this blood flow over there. So it can accommodate all of this blood because it is highly elastic. That is why it is also called as the Wind-Kessel vessel. So aorta and pulmonary artery, they are both highly elastic, and their elasticity is because they contain a lot of elastic fibers, right? And these arteries, they distend when the blood pressure rises during systole, and they recoil when the blood pressure falls during diastole, and that effect is called as the Wind-Kessel effect. Okay, so aorta, they are called as Wind-Kessel vessel because of the elastic property of them, and they show the property of Wind-Kessel effect. That is, these arteries, they will distend or they will dilate when the blood pressure rises. So you can see in this picture, during systole, when the blood is being ejected out from the aorta to the from the left ventricle to the aorta. So what happens? These blood vessels, they will dilate, or this will descend outward, right? And that is happening during systole, right? And at the time of diastole, what happens again? They will now recoil back, right? They will recoil back, or they will squeeze the blood towards the arterioles, and this effect of the aorta is called as the Wind-Kessel effect, right? And because of this effect, the pulsatile ejection of the heart is converted into the steady outflow. Because of this Wind-Kessel effect, the pulsatile ejection of the heart is converted into steady outflow, right? So you can see the time of systole, there is dilation or distension of the vessels, and at the time of diastole, when the arterial valve closes and no more blood is passing, the elastic vessels, they will now recoil back, and they will squeeze the blood to flow forward, and that because of that the blood flow is always steady in the aorta. Now the Wind-Kessel effect or Wind-Kessel vessel, they become diminished. This Wind-Kessel effect, it diminished at with the age. When the person age, this effect is declined because the arteries, the aortas, they become less compliant, and they undergo changes like atherosclerosis, and because of that, what happens? The Wind-Kessel effect is been decreased, and that will lead to increase in systolic blood pressure. Initially, you saw that when the pressure was increased, they dilated outward. Because of that, there was not much fluctuation in the pressure. But when the arteries or the aorta, they have become hardened, and when the blood is flowing from the left ventricle to the aorta, what happens? The blood vessels, they are not dilating, and because of that, there will be increase in systolic pressure generally as the person ages, right? Now the next vessel is arterioles, right? Now you can see in this picture like how this aorta, they will branch out to form artery and then arterioles. These arterioles, they are the vessels which offer resistance to the blood flow towards the capillaries. They are also called as precapillary resistance vessels, or also called as precapillary sphincters, right? So these resistance vessels, they are offering resistance to the blood flow towards the capillaries. That is why they are also called as resistance vessels. Okay, so why arterioles are called as resistance vessels? Because like these arterioles, they are very much, in this picture you can see over there, arterioles, they are very much rich in smooth muscle. Because of that, they have much capacity to contract or relax, and they offer the maximum resistance for the blood flow, right? And that is why they are called as the resistance vessel. Now they offer maximum resistance to the blood flow towards the capillaries. Therefore, they are the main site for the peripheral resistance. And one more very important thing about this resistance vessel is that resistance is inversely proportional to the fourth power of the radius of the arterioles. So read this line again. Resistance is inversely proportional to the fourth power of the radius of the arterioles. That means if that like this resistance is very much influenced by the radius of the arterioles. Okay, so resistance, it is highly influenced by the radius of the arterioles, because you can see that it is inversely proportional to the fourth power of the radius of the arterioles. That means if the radius is decreased to only half, the resistance to the blood flow can increase by 16 times, and if the radius is increased to 2 times, the resistance to blood flow can decrease by 16 times. So just a big change in the radius can influence the resistance to a very high amount, right? So if the resistance or if the radius is decreased to half, then the resistance will be increased by 16 times. And when the radius is increased to 2 times or double, the resistance to blood flow will decrease by 16 times. So resistance is highly proportional to the inversely proportional to the radius of the arterioles. Now this precapillary sphincter, as I told you earlier, they have this ring of smooth muscle at the meeting point of capillaries to arterioles. So in this picture you can see we have the arterioles over there, and before they branch out, we have this precapillary sphincters, or we have these arterioles over there. And these arterioles, as I told you earlier, they are the smooth muscle, right? They are smooth muscle. They are rings of smooth muscle, and these ring of smooth muscle or the precapillary sphincter, they determine the size of the capillary access area at one particular movement of tissue. So it depends upon the sphincter how much the capillary will get the blood flow. And this precapillary sphincter, they are highly under the influence of the sympathetic nervous system. So they are highly affected by the sympathetic nervous system. So if there is increase in sympathetic activity, what will happen? There will be constriction of the arterioles, and when there is constriction of the arterioles, there will be increase in vascular resistance, right? So increase in vascular resistance will cause decrease in the distal blood flow, right? I hope you are understanding. So arterioles, they are ring of smooth muscle at the point of capillary to arterial, and they determine the capillary exchange area, right? And this resistance, they can be altered, and the main alteration is done by the sympathetic nervous system. As I told you, sympathetic nervous system, they, when they are increased sympathetic activity, there will be constriction of these arterioles, and that will cause increase in vascular resistance, right? And increase in vascular resistance will cause decrease in distal blood flow. At the same time, they are also influenced by the local concentration of the tissue metabolites. So there is some tissue metabolites that will also influence the sphincter activity. For example, whenever there is increased serotonin or whenever there is fall in temperature, there will be increase in constrictor activity, because they are the local constrictors, right? So there will be constriction of the precapillary sphincter, which thereby decrease the blood flow. At the same time, there can be local dilators, like in case of hypoxia, in case of increase in body temperature, in case of accumulation of carbon dioxide, they are going to cause going to cause the dilation of this precapillary sphincter, and that will lead to dilation of the precapillary sphincter and decreased resistance and increase in the distal blood flow, right? So that was about the precapillary sphincter, also called as arterioles, also called as the resistance vessels. So whenever you say resistance vessels, it is the arterioles. Why arterioles? Because they contain the ring of smooth muscle, which cause resistance of the blood flow towards the capillaries. Then we have the capillaries, or also called as the exchange vessels. So I think you know about this, like in the capillaries, there is going to be the exchange of the nutrients and waste between the body cells and the body. That is why between the body cells and the blood. That is why they are called as the exchange vessels. So exchange vessels, they are the vessels which allow easy exchange of the nutrient and the waste between the body cells and the blood. That is why they are called as the exchange vessels, right? And areas with high metabolic requirement have extensive capillary network, like in case of muscles, liver, kidneys, nervous system. You can find that there is extensive capillary network. And areas with very low metabolic requirement, they lack capillaries, like for example in the cornea, in the lens of the eye, in nails, in hair follicles, in cuticles, and in cartilage, there is lack of capillaries. So wherever the metabolic requirement is high, the capillary network is high, because there is the metabolic requirement is more, nutrients need is more, at the same time the waste product formed is more. Because of that, there you can find extensive capillary network. Okay, so this is the capillaries or the exchange vessels. Now capillaries, if you see, we have different kind of capillaries in our body. So first one is the continuous capillary, second is fenestrated capillary, and third is the sinusoid capillary. Now what do you understand by continuous capillary? In continuous capillary, as the name suggests, the cells are continuous. So there is a single layer of endothelial cells, and they are almost continuous, right? And these capillaries, they allow exchange of fluid and water soluble substances within the interstitial fluid by diffusion, right? And this type of capillaries are seen in most of the body capillaries. So most of the body capillaries are of this type, that is continuous capillary, where it is formed by a single layer of endothelial cell, and the cell is almost continuous, and there might be some at the intercellular region, there might be a small gap of 10 nanometer wide, but they are considered to be continuous. Okay, and it is type which is seen in most of the body capillaries. The second one is fenestrated capillaries. So as the name suggests, fenestrated, and you can see in the picture, they are fenestrated, they have the pores. and the pore diameter can range from 20 nanometer to 100 nanometer, and they are these are seen in renal glomeruli, in vasa recta, in endocrine, in exocrine gland, and in choroid plexus. Okay, so fenestrated capillaries, they are having pores, and these pores serve the function of rapid and large transudation of fluid. So because there are pores present, so the exchange is in a very rapid and a large amount, right? Now the third one is sinusoid. So sinusoid, as you see in the picture, the gap between the endothelial cells is very large. So there is large gap between the endothelial cells, right? Therefore, they allow large exchange, or they allow exchange of large protein molecules and RBC, and they are mainly seen in bone marrow, in the liver, and the spleen, right? So continuous capillary, the cells are single lined, but they are continuous, and they are found in most of the body capillaries, right? And fenestrated, they have fenestration. They have small pores like thing, and these pores are responsible for rapid and large transudation of fluid, and they are mainly seen in renal glomeruli, in vasa recta, in endocrine glands, and exocrine gland as well, in choroid plexus. And sinusoid capillaries, as you see in picture, they have large cap, and they are found in the bone marrow, liver, and spleen, where large protein molecules exchange occurs, right? So these are the uh, Wincastle vessel, then these are the resistant vessel, and these are the exchange vessel, right? And what is capacitance vessel? So veins and venules, they are the capacitance vessel. Why they are called as capacitance vessels? These are the vessels which can accommodate large volume of blood per unit length by change in their luminal shape. Now these veins or venules, they are like they shape around oval in shape, and and they can change the shape to circular, and they can accommodate large volume of blood per unit length without much increase in the pressure, right? And that is why they are called as the capacitance vessel, right? So you have to always remember that whenever we talk about Wincastle vessel, it is aorta and the pulmonary artery we are talking about. And you know what is Wincastle? It is the elastic property which causes distension and relaxation or equal impact of the vessel, right? Then we have this resistance vessel, which are arterioles, and they are having this resistance because they are creating this resistance because they have this a large number of smooth muscle, right? And this smooth muscle can contract or relax and offer the maximum resistance for the blood flow, and they are influenced by the sympathetic nervous system as well as some of the local factors, local vasoconstrictor and local vasodilators. Then we have exchange vessel, which is the capillaries where exchange of the nutrients occur, and we have three different type of exchange vessel. Then we have the capacitance vessel, which are veins and venules, and they are called so because by changing their shape, they can accommodate large volume of blood per unit length, and that's why they are called as the capacitance vessel. Now we are going to talk about, so till now we talked about how the blood is being circulated in our circulatory system and how each of these vessels are influencing the blood flow. Now we are going to talk about what are the factors that can affect hemodynamics, that can affect the flow of blood, right? So hemodynamics can be very much influenced by the blood flow, by the pressure gradient, by the vessel diameter, by the blood velocity, and by different kind of forces, right? And by the resistance. So all these factors are going to affect the hemodynamics. So let us see how these factors are going to affect the blood flow. So first of all, what is flow, blood flow? What do you understand by blood flow, and what do you understand by blood velocity? So flow is the amount of blood moving per unit time, right? So blood flow is the amount of blood moving per unit time, okay? And velocity, it is defined as the speed of blood in unit time, okay? So flow is the amount of blood moving per unit time, whereas velocity is defined as the speed of the blood in unit time. And we can calculate velocity of the blood by a simple formula, which is Q is blood flow and A is cross-sectional area. Okay, so velocity of the blood flow can be calculated by velocity is equal to blood flow divided by cross-sectional area. Now this blood flow, which is Q, it is generally considered to be cardiac output. Okay, so blood flow is generally considered to be cardiac output, which is around 5 liter or 5000 ml, right? And A is the cross-sectional area. Now let us see how the change in the cross-sectional area is going to change our velocity. Now let us see the cross-sectional area in each of our vessels. So cross-sectional area, if you see in aorta, it is 2.5 centimeters square, whereas you can see in capillaries that the cross-sectional area is like very high. It is 2500 centimeters square. Now the cross-sectional area in the capillaries is very much high because of the much division of the aorta to the arteries, arterioles and capillaries. So it has been like divided so many times, which will increase the cross-sectional area, right? So that is why the capillaries have the increased cross-sectional area. Now let us see the flow or the velocity of blood in aorta and the capillaries by that simple formula which we had just discussed. So velocity of the blood flow through aorta. Okay, so velocity is equal to blood flow divided by area, right? So blood flow is 5000 ml and the cross-sectional area of the aorta is around 2.5 centimeters square. Now if we divide 5000 by 2.5 centimeter, then it will come around 2000 centimeter per minute, or it can come around 33 centimeter per second. Now let us see at the capillaries. How will be the velocity of the blood flow in the capillaries? So it should be more or less. What do you think? In the capillaries, the blood flow should be more or less. Anyone can answer?
Less.
Less, ma'am.
More.
Velocity of the blood flow in the capillaries should be more or less.
Less.
Velocity will be less.
It should be less. So let us see how the blood flow in the capillaries can go less. So velocity of blood flow is again Q by A. So Q is 5000 and the cross-sectional area is in the capillaries is from 2500 to 3000 centimeters square. So we have put here 3000 and it will come around 1.6 centimeter per second per minute or 0.027 centimeter per second. So you can see the cross-sectional area can influence the velocity of the blood flow. So since the cross-sectional area in the capillaries is much high, and because of that the velocity of the blood flow is less, and we need the velocity of the blood to be slower in the capillaries because it is the area where the exchange has to occur, and because of that the blood flow should be also, or the velocity of the blood flow should be decreased at the capillary area. Okay, so this particular formula tells you how cross-sectional area is going to affect the velocity of the blood flow. So higher the cross-sectional area, the velocity of the blood flow will be slower, right? Now next thing what we're going to see over here is modes of flow in a vessel. So blood flow in the blood vessel, it can be laminar, it can be turbulent. Now what do you understand by the laminar and what do you understand by turbulent? So let us see here. So in laminar flow, it is generally seen in the smooth vessel, right, where the blood flow in a straight lines. Now and if you see the forward, the anterior part of the blood, you can see the parabolic profile. Now why we see parabolic profile in the laminar flow? The fluid which is touching the wall, right? They barely move because of adherence to the vessel wall, right? And the next layer slips over this, and the third layer slips over the second, and so on. And because of that, they are going to form this parabolic profile. And this kind of blood flow is considered to be a smooth blood flow or the laminar blood flow. Okay. So wherever there is smooth blood vessel, the blood flows in a straight line, and the anterior part of this blood flow, there will be parabolic profile, and this parabolic profile occurs because the fluid which is touching the wall, they do not move because of the adherence to the vessel wall, and the next layer above it will slip over this layer, and the third layer slips over the second, and so on, and forms the parabolic profile, which is called as the laminar flow. Whereas in case of turbulent flow, the rate of blood flow makes a sharp turn. Now, why the blood flow makes a sharp turn when it's flowing in the uh, blood vessel? It is because there can be some obstruction in the vessel wall, or because of some rough surface in the vessel wall, the blood flow, as it is flowing, there can be sharp turn, right? Now this turn will cause the blood to flow crosswise in the vessel wall, as well as along the vessel, forming the hole in the blood. So because there is some obstruction in the vessel wall, right, this obstruction will cause the blood to make a sharp turn and flow back, and again there will be flowing in the haphazard way, forming the holes in the blood. And these holes, the blood flowing in either direction, either thither, this kind of movement of the blood in the blood vessel will create a current which is called as the eddy current. And this eddy current is like very dangerous because it is continuously going to create a pressure in the vessel wall, and it will hit the vessel wall continuously, and it will damage the vessel, right? So this eddy current, because of the turbulent blood flow, will increase the pressure, and it will continuously hit the blood vessel, causing the damage to the vessel wall, right? Eddy current, you can hear it in blood vessel with the help of stethoscope. And when you hear the eddy current with the help of stethoscope in the blood vessel, they are called as bruit, B-R-U-I-T, bruit. And if this eddy current you are going to hear in the heart, right, this eddy current is called as the murmur. Okay, so this turbulent blood flow is going to create an eddy current, and this eddy current we are going to listen to it with the help of stethoscope. And if you are going to hear the eddy current in the blood vessel, they are called as bruit. And if you are going to hear the eddy current in the heart, they are called as the murmur. Now, whether the blood flow is laminar or whether the blood flow is turbulent, to find out that, some scientists have given one formula, and that formula is called as the Reynolds number. Okay, so by knowing the Reynolds number, you can know that whether that blood flow is laminar or that blood flow is turbulent. So this simple formula, not exactly simple, but this formula can tell you whether the blood flow is laminar or turbulent. So Reynolds number, also denoted by Re, is equal to velocity of blood into density of blood into diameter of blood vessel divided by the viscosity of the blood. Okay, so viscosity, it depends upon the hematocrit, right? And what is hematocrit? Hematocrit is more of RBC. So increase in RBC can occur in multiple myeloma, and it can also occur in bone cancer, right? So, and also there can be some physiological causes where there can be increase in viscosity, like when you are not drinking enough water and losing water, hematocrit will rise, right? Hematocrit will rise, and that will cause increase in viscosity, and that will decline in Reynolds number. So Reynolds number, if you calculate, and if you exceed 2000, right? then it proves that it denotes that it is turbulent blood flow. So when the Reynolds number is more than 2000, it indicates turbulent blood flow. And this is usually seen following constriction of an artery, which increases the velocity of blood, or in anemia where the viscosity of blood decreases, because you saw earlier that when the um, viscosity of the blood increases because of increase in hematocrit, the Reynolds number declines. But in case of anemia, the viscosity declines, right? And also when there is constriction of artery, there can be increase in the Reynolds number, and increase in Reynolds number more than 2000 indicate turbulent blood flow. Okay, so this is how we can know whether the blood flow was turbulent or whether the blood flow was streamlined, by knowing the Reynolds number. Okay, now let us see the interrelationship between the pressure, flow, and resistance. Okay, so blood flow is determined by two factors, that is pressure gradient of the blood between the two ends of the vessel, which is called as the pressure gradient, and the impediment to blood flow through the vessel, which is called as the vascular resistance. Okay, so earlier we saw that the blood flow can be laminar or turbulent, right? And it was determined by the Reynolds number. Now we are seeing that how pressure, how resistance is going to affect the blood flow. Okay, so the relation between the blood flow, the relation between the pressure gradient and the resistance is given again by one scientist, by one formula, and that formula is Ohm's law. So Ohm's law says that flow is equal to pressure gradient divided by resistance. That means if the resistance increase, the flow will be declined, and if the resistance decrease, flow will be increased. And we can put this formula other way around, that is we are going to find the resistance. So to find the resistance, we have resistance equal to pressure gradient divided by the flow. Okay, so by knowing this formula, we can find out how much resistance is present in our circulatory system. Okay, so this is the relationship between the blood flow, resistance, and the pressure gradient. So by this formula, you can see over here that if there is increase in pressure gradient, then resistance will also increase, and if the flow is decreased, then the resistance. So there is inverse relationship between the resistance and the flow, and direct relationship between the resistance and the pressure gradient. So let us see how it has been calculated. So by previous formula, we saw that resistance is equal to pressure gradient divided by the blood flow, right? So here we are taking the example of systemic circulation and the pulmonary circulation. So we are going to calculate the resistance in the systemic circulation, and we are going to calculate the resistance in the pulmonary circulation. So if you remember our second diagram where we were talking about this pressure changes, so pressure gradient in the systemic circulation can be from 95 in the aorta and 5 in the venules, right? So the pressure difference will be around 90 millimeter of mercury, and the blood flow, as I told you earlier, it will be 5 liter per minute. Now, if you calculate the resistance in the systemic circulation, it will be 90 divided by 5, that will give you around 18. That means in systemic circulation, the resistance is around 18, all right? And in case of pulmonary circulation, okay, so we are going to again calculate it. So pressure in the right ventricle is around 15 to 25. So we are just taking 15, and then in the pulmonary vessels it is around 5. So 50 minus 5 is 10, and divided by 5 is again the blood flow. This is 5 liter. That will give you around 2. So in pulmonary circulation the resistance is less, whereas in case of systemic circulation the resistance is more. Okay, so by this relationship between the flow, resistance, and the pressure gradient, we are able to calculate the resistance in the systemic circulation and the pulmonary circulation. And we saw that in circulation the resistance is more, and in the pulmonary circulation the resistance is less. Alright. Now resistance to blood flow can also now depend upon the series and the parallel vascular circuits. So if you see our body, we have these two different kind of vascular circuit. One is series vascular circuit and one is parallel vascular circuit. Now this series vascular circuit, we can find it in case of this GIT, and in case of this series resistance. This one is the series vascular circuit and this is the parallel vascular circuit. Now if you see the series vascular circuit, it is seen that one particular organ, it is supplied by the large artery, then smaller arteries, arterioles and capillaries. So this represents an arrangement of blood vessel within a given organ. And this is the parallel vascular circuits. So parallel vascular circuit, you can see it in case like the blood flow is going to the GIT, to the hepatic, to the central nervous system, like the blood flow has been carried or supplied in a parallel fashion. That is the parallel vascular circuit. Now we're going to see that how resistance differ in the series circuit and how it differs in the parallel vascular circuit, right? Now if you see in the series resistance of blood flow in series, the arteries, arterioles, capillaries, venules and veins, they are collectively arranged in series, right? So you saw in the previous picture, they are arranged in series, right? When blood vessels are arranged in series, blood flow through each vessel is same and the total resistance to blood flow is equal to the sum of the resistance of each vessels. Okay, so resistance of the blood flow in when we are talking about the blood resistance of blood flow in series, the total resistance is the sum of the individual resistance. Okay, the total resistance is the sum of the individual resistance created by each of the vessels. When we talk about resistance of blood flow in parallel, so blood vessel to brain, kidney, muscle, GIT, they are arranged in parallel. So blood flow through each tissue is a fraction of cardiac output and is determined by the resistance and the pressure gradient. So if we have to find the total resistance to the blood flow, it is expressed in case of parallel vascular circuit as 1 by R total is equal to 1 R1 plus 1 R2, 1 R3, 1 by R4 and so on. Thus, the total resistance is less than the resistance of any single blood vessel. Okay. So in case of parallel resistance, the total resistance is less than the resistance of any single blood vessel. That means if you add one more vessel to the circuit, there will be decreased resistance and increased blood flow. Okay. So in case of parallel blood flow, as the total resistance is less than the resistance of any single blood vessel, right? So if you add one vessel to the circuit, there will be decreased resistance, right? Like and if you decrease one vessel to the circuit, there will be increased resistance. For example, you can see in a people who have this amputation of the limb or where there is surgical removal of one kidney. In those people, as we are removing one of the vessel from the circuit, that means what will happen? There will be increase in resistance and there will be decrease in blood flow. So that is how resistance will affect the blood flow when they are in series and the parallel vascular circuit. Last but not the least, we have the Poiseuille's law, which also talk about the resistance only. So in Poiseuille's law, you can see this formula over here. This is 8 into viscosity of blood into length of the vessel divided by pi r4. Okay, so Poiseuille's law states that flow of blood is related to number of factors. Okay, so again here it says about the viscosity of the blood, the pressure gradient across the vessel length, and the radius of the vessel. So Poiseuille's law now also talks about the resistance and how each factor is affected by the which causes resistance. Okay, so in this formula, so you can take this formula or this formula, it's same thing. We have to calculate out, and you can either get this equation or this equation. Okay, and it's both the same thing, right? So here we are focusing on the flow of blood. Here we are focusing on the resistance of the blood flow. So if you take this particular formula where it says resistance is equal to 8 into viscosity of blood into length of vessel divided by pi r4. R is again radius of the vessel. Okay, so according to this formula, if you double the length, then what will happen to the resistance? Resistance will be increased, no? So if you increase the length of the blood vessel, there will be increase in resistance, right? But length is not very important for cardiovascular system, as the length, they do not change as such, right? But radius is changing and the viscosity is changing. So how viscosity is changing? As I told you earlier, hematocrit. Viscosity depends upon hematocrit. So if hematocrit is increased, as I told you earlier, in multiple myeloma or in case of bone marrow cancer, bone cancer, then what happens? There will be increase in hematocrit. Also, in physiological condition, when we don't drink water for a long time, the viscosity or the hematocrit can increase. So when the hematocrit is increased, then what will happen? Resistance will increase. Now, when the resistance is increased, then there will be decline in the blood flow. So that is how viscosity is related with the resistance. Now, here one more thing is important, which I've already mentioned you earlier also. Whenever there is decline in hematocrit, like in case of anemia, right? Then what will happen? Because viscosity will decrease. Now, when the viscosity decrease, what will happen to the resistance? Resistance will also decrease. Now, when the resistance decrease, then what will happen to the flow? Flow will be increased. I'm talking about the condition anemia. So when anemia is there will be decline in viscosity or there will be decrease in viscosity. So when there is decrease in viscosity, there will be decrease in resistance. So when there is decrease in resistance, there will be increase in blood flow. Now, if the anemia is severe, then the blood flow can be so rapid that it will create the eddy current, which we had discussed earlier. And if there is eddy current, then again, what will eddy current do? Eddy current will continuously put a pressure on the vessel wall. It will hit the vessel wall and damage the vessel wall, right? So less viscosity is also very dangerous, and high viscosity is also dangerous. That's why we have to treat the viscosity. But here, what is very influenced, how the resistance is more influenced is by the radius of the vessel wall. So you can see how they are related. Resistance is inversely proportional to the fourth power of the radius. That means even the radius is decreased to half, then what will happen to the resistance? Resistance will of the blood flow will increase by 16 times, right? So if the radius, so resistance is very much influenced by the resistance is highly influenced by the radius. That is, if radius is decreased to half, the resistance can increase to 16 times. And when the resistance is increased to 16 times, what will happen to the blood flow? Blood flow will be highly decreased, right? Likewise, if radius is increased to 2 times, then what will happen to the resistance? The resistance to the blood flow will decrease by 16 times. So when the resistance decreases, then what will happen to the blood flow? Blood flow will increase. So by this Poiseuille's law, we are establishing a relationship between the resistance, between the length of the blood vessel, and between the viscosity and the radius of the blood vessel. How each of these factors are interrelated and how this can affect the blood flow. Okay, Poiseuille's law. Okay, so that finishes today's class. I think it was very kind of boring also, but you have to study and please do study. Okay.